As we have discussed previously that joints they are the point of contacts between the bones or between the bones and the cartilage. We have discussed these three types of joints in the previous presentation. Now in the synovial joints we know that they are filled with a fluid filled synovial cavity. Here you can see, and the joining surfaces of the two bones there is a fluid filled cavity. This arrangement allows the movement, and these joints they help in locomotion and the other movements. So many types of synovial joints they are shown here in this slide. First is, you can see the ball and socket joint. Now ball and socket joint they are there in between the humerus and the pectoral girdle. In the pectoral girdle and the pelvic girdle, ठीक है, both they are ball and socket joints. Then second type of joints are the hinge joints. You can see here that is between the knee and the elbow joints, they are the hinge joints. Then we see the pivot joint. Pivot joint is there between this vertebral column, that is in between the two vertebrae. This pivot joint is there, that is between the atlas and the axis. Between atlas, that is the first vertebrae, and the axis, that there is a pivot joint. Then is the gliding joint is there between the these carpals. Here you can see these are the gliding joint between the carpals is there, and saddle joint is between the carpals and the metacarpals. Carpals और metacarpals के बीच में saddle joint होता है, and between the thumb also. So these are the few examples of the synovial joints. Let's talk about the disorders of the muscular and the skeletal system. We'll discuss here about a few disorders, that is Mestenia gravis, muscular dystrophy, tetany, arthritis, osteoporosis and gout. First we see Mestenia gravis. It is a long-term neuromuscular disease. It depends on the skeletal muscles weakness, and the most commonly affected muscles are those of the eyes, face and in swallowing, and it can result in double vision, drooping eyelids, trouble talking, trouble walking, and this onset can be sudden. It's an autoimmune disorder which affects the neuromuscular junctions, and it leads to fatigue, weakening and paralysis of the skeletal muscles. Muscular dystrophy is again an inherited disease which transmits from one generation to the next, and it damages and weakens the muscles slowly. This damage is due to the lack of a protein that is called as dystrophin, and that is why the name dystrophy. It is necessary for the normal functioning of the muscles, and the absence of this protein results in problems in walking, swallowing and muscle coordination. So muscular dystrophy is a progressive degradation of the skeletal muscles, which is mostly due to genetic disorders. So this is a normal bicep, and this is a bicep with a muscular dystrophy. You can see the difference. Now tetany is a condition which is due to the low blood calcium, which is also called as hypocalcemia, and it is characterized by the spasm of the hands and the feet, cramps of the voice box, that is of the larynx, and other neurological reflexes. It is generally considered as a result of low calcium levels in the blood. So rapid spasm, wild contractions in muscles due to calcium, low calcium in the body fluids. Arthritis. Arthritis is the inflammation of the joints. It affects the multiple joints also. More than 100 types of arthritis are there. The different causes and treatments, and the most commonly are the osteoarthritis and the rheumatoid arthritis. You can see here the reduced joint space is there. Wearing and tearing of the cartilage takes place. Swollen, inflamed synovial membrane is there, this part, and there is an erosion in the bone. So this is a healthy joint. You can see the cartilage and the meniscus of the joint is there, but in a rheumatoid arthritis, which is also an autoimmune disease, you can see how the difference is there. Osteoporosis. It is an age-related disorder, and here the decrease in the bone mass may occur, and with the increased chances of fracture are there. So decreased level of estrogen is a common cause, especially in the females due to in the age-related disorders. Body starts losing bones, too brittle, too little bones, and bones they become weak and they break or fall in a serious case, sneezing or minor bumps. So osteoporosis means porous bone. You can see here the pores in a diseased person. So healthy bones look like a honeycomb, and this looks like a with more pores. Gout. It is a type of arthritis that occurs when there is a uric acid deposition in the blood. High uric acid levels that causes monosodium urate crystals to be formed in the joints. Severe pain, tenderness, redness, inflammation can result, and gout mostly affects men, and it also affects women in the late in the after 50s or 60 years of age. So that is all for this chapter, movement and locomotion. Thank you so much.